Assalamu alaikum and welcome to Askanwi Media. I'm your host, Yusuf Taylor, the editor for Askanwi Media. And with me today is our capable reporter,
Edward Francis Dahlia.
Edward has been with us for a while now. He's been working and reporting. We attend press conferences. And today's video is slightly different because just last week we had the opportunity to attend a press conference which went well. We asked questions and we got answers, which is what inspired this video. So we're doing two things at the same time. My colleagues are behind the scenes filming and shooting this video. Meanwhile, we are going to be talking about this press conference, how journalists ask questions, how we prepare for press conferences, and how we make sure that our questions are answered. Before we dive right into it, please make sure you like, subscribe, and share this video, and also hit the notification bell. So preparing for the press conference begins well before the actual press conference. One of the important things which I do, and I tell my staff to do, is to visit their website, look at what news outlets are saying, have been published on there, and then also make sure you look at even parliamentary inquiries. Have Parliament given any resolution that relates to that institution? So with that, when you go through all that, and even the budget, people like me will like to look at the budget. When you go through all that, one of the things which I always tell my guys is make sure you come up with at least 5 questions, 5 solid questions, Edward, isn't it?
Yeah, but why 5 questions?
We get 5 questions because sometimes even during the press conference, the speaker might answer your question if you are paying attention, right? They may say something which actually answers your question. Another journalist may come and even ask your own question as well. So when that happens and you had only one question, then you will have no questions to ask. And that's why we have at least 5 questions. Like in this instance, we realized that one of the questions which we wanted to ask was actually answered by the director for the NHIS, and that was how many people benefited from the scheme.
Since the rollout of the NHIS, we have seen remarkable progress. To date, over 29,000 have been enrolled and have actively benefited from maternal and child health services delivered through 69 contracted health facilities across all the 7 regions of the country.
So we quickly used that answer to adapt our question on the spot. But this was because we were prepared and we were listening. There's no way you can do that if you were not prepared and if you were not listening. So we asked another question, which you would see. So my question is basically, you did mention that it's you are limited by your financial capacity. Yeah, something along those lines, pretty much. So, and I observe, just preparing for this press conference, you increase from 13 facilities to 69, which is more than, it's quite a big job, isn't it, in 1 year?
That's what we call exponential growth.
Exactly. But when I looked at the budget, I realized that in 2023, this is what is in the budget, your subsidy, National Health Insurance subsidy, you had 27 million, which was actually spent. And then in 2024, 0 was approved. That's what I'm seeing here. Perhaps you can clarify. I know this year you have 50 million to work with, right? How much did you spend in 2024 to get these huge numbers? 29,000 people benefited, you've said. Please.
I think the first point of departure is a distinction between the authority and the scheme. So that 0 figure you are looking at was the scheme. 2021, 2022, 23, we all had budgets for the authority, operating expenses. So in terms of providing a budget for 2025, 2024, 2025, that's when it was approved. So at the starting point, there was a confusion. Yeah? The original idea was that when you give money to the authority, you are giving money to the scheme. But everybody knows that, I mean, the scheme is huge. In fact, 50 million is not even enough. So the understanding was to reinforce the difference between the authority, which is us, the body of people, who incur operating costs, rent, salaries, building, cars, fuel. That's what the forced budget allocation was for. And then some people were pushing from that allocation, we should be able to pay claims to hospitals. We said, no, hang on. If you do a pilot just with Bundung, I mean, you're going to be spending millions. So there has to be a separation. So luckily, during the budget bilaterals, we succeeded through the support of the PAMSEC Ministry of Health in creating a new line item called the National Health Insurance Scheme.
Okay.
Yeah. Now that separates us.
Okay.
See, the authority, here are your salaries, your operating costs, but do not touch money that is meant to pay claims. Now the 50 million came and said, if you take care of people at the contracted health facilities, the facilities will now send their claims and you'll pay them from this 50. Don't touch it for salary, don't touch it for travel, don't touch it for other things. And now the accountability is easier. Yes. So that is why you saw those gaps. What we were getting prior to 2024 was money for the authority. Now what we are getting is both for authority and for the scheme. Now the 50 is solely for the scheme. For the authority, there are other allocations which may interest you.
Yeah, but watching the video, it seems like your question was not answered. So in this case, what will we do?
At this time, when we ask a question and it's not been answered, you have to interject as politely as possible. And most of the time, you find an opening to interject. You don't just rush in. Sometimes they are looking at you. Body language is also part of it. You know, as I'm looking at you and I try to get your attention, sometimes they are trying to get your attention. If they are answering your question, shake your head like nod, give them a yes. If your question is not being answered, you know, give them a puzzling look, like shake your head slowly from side to side to show that, no, you're not answering my question. I use words like sir, honorable, ma, madam. It's just the way that my upbringing that I'm used to speaking to people, and hopefully I try to give the respect for them to hopefully give that respect back. But that's all what you can do as a journalist. So you can see I interjected as politely as I could. And sometimes you need to rephrase your question.
Thank you.
But you didn't answer my question.
Okay.
Which was, what I know is that the budget tells me that you spent 27 million in 2023. What I don't know, and we're in July 2025, what I don't know is how much did you spend on the scheme in 2024, last year? That's my question.
I can give you a breakdown. So in terms of our expenditure, it comes in two folds.
Yes, sir.
We are paying for claims for members that we have provided the services, and our contracted facilities submit those claims. And there is also the performance-based financing, which is exclusively funded by the World Bank. So in terms of the claims, in quarter one of 2024, we paid about 529,000. So it's gradual. Quarter 2 2024, it increased to 4 million, right? Quarter 3 of 2024, it increased to 6 million, about 6.2 million. Quarter 4 of 2024, about 10 million. Now in quarter 1 of 2025, it's still at 10 million, 660. So based on the, yes, and this excludes the second quarter. In terms of the performance-based financing payment that I talked about, this is actually geared towards ensuring that you drive quality, right? In quarter 2, we paid, quarter 2 of 2024, we paid about 1.4 million. And we are not only paying health facilities, we are also paying the regional health directorates. We pay them about 1.6. So it's a little bit mixed because there is a, cash flow from the World Bank and also from domestic government. But we would be happy to provide a summary of these statistics.
In that response, he gave a lot of numbers, a lot of figures. But one of the mistakes that many of us journalists do, we just write all these numbers and we just put it in our story. Really, it's not user-friendly. What you should do, and the best way to do, is to use an image. Prepare a chart. In Askanwi, we love our infographics. Use PowerPoint, use Excel, and come up with something simple. Try not to complicate it too much, or else you will lose your viewers, you will lose your readers, the people who are looking at the chart, right? So I just use basic charts, and you can see on the screen one of the charts from the information that was provided. We could have just used numbers, but when we show it in the screen now and you're looking at it, you can see a chart and it tells you a lot more than just empty numbers would have. Finally, we've come to the end of the video. If you've learned something as a journalist or even a member of the public, civil society, researcher, please like, share, and subscribe to our channel. You can also hit the notification bell. If you can donate to us, that would really help us to make sure we continue doing what we do. And we also sent follow-up questions. This is something that I want to encourage journalists to do so that we can get some of the data which they promised if you were watching the responses. And hopefully would be able to come up with a second episode and bring that to you. Make sure you don't go anywhere. Stay tuned to Askanwi Media. I'm your host, Yusuf Taylor, with my able journalist,
Edward Francis Dahlia.
Thank you very much for listening.